If someone is concerned they may be having a heart attack in the form of chest pain or shortness of breath or sweating, they should get medical help. They should get to the nearest medical facility which is open. The chances of somebody dying from a heart attack is much higher than somebody dying from corona infection. Therefore, it's very important that patients get to the nearest medical facility that is open for heart attack treatments. But when they do get to the medical facility, patients with fever, with a recent history of travel, or symptoms of cough or sneezing should certainly let the medical personnel know so that they can protect the patient, their relatives, the community, and also the medical personnel involved in that hospital. Now in the corona time, many hospitals are shut. It's very important they get to a heart center, which is a hospital that has 24/7 heart treatments of all modalities available. If they have an ECG done and if they have a blood test done, usually that will rule in or rule out a heart attack. Usually, almost 95 to 99%. It's very, very sensitive. On the other hand, coronavirus per se can affect the heart too. Very few patients across the world have also had heart attack like symptoms mimicked by corona. The only way to find out is to get to the nearest medical facility that has a 24/7 cardiology department and a heart service available for them to be assessed and for them to do the needful. The first and foremost that we do when a patient comes in with heart symptoms is we make a decision whether it's an emergency or a non-emergency. Non-emergency irunda, most patients are advised appropriate treatment which can be taken at home. Usually it's in the form of precautions and tablets for them to come back after a few days. But if it's an emergency such as a heart attack or sometimes dangerous heart rhythms or heart failure, sometimes fluid in the lung where they have to be admitted, in the mari emergencies edavadhu irunda, then we will admit them and we will manage them like any other heart patients that we did even before, except we take extra precautions both for the patient's best interest, our relatives' best interest, and also the medical personnel involved. So we wear protective equipment, we carry on heart surgeries or angioplasties if needed, and the idea is to treat the patient in the best possible manner so that they are discharged as soon as possible. The longer they are in hospital, the higher the risk, and the higher their contact with others, and the higher the risk of any transmission if they are infected. Adallam minimize pandradhukku we take a clear history of travel. Fever edavadhu irunda, then we will take appropriate measures to try and quarantine these patients in isolation wards. Appadiyella illana, we will just treat them like any heart emergency so that they can get home as quickly as possible, having received the most efficient treatment. Of course, we take precautions, but there is a risk of transmission without doubt, and this is higher for healthcare professionals. It's not just me, நான் மட்டும் கிடையாது, இங்க nurses, cleaners, security personnel, car park personnel எல்லாருமே செல்ஃப்லெஸ்ஸாக டியூட்டிக்கு வரணும், நம்ம வேலையை செய்யணுன்றதுக்காக எல்லாருமே இங்கே 24/7 ஒர்க் பண்ணுறாங்க. Certainly there is a risk of transmission to healthcare professionals, that includes me too. இதை முடிஞ்ச அளவுக்கு ப்ரிவென்ட் பண்ணுறதுக்கு we try and avoid admissions. அதனால தான் government regulations and rules are there to try and stay at home and not to come unless there is an emergency. அப்படியே emergency வந்தாலும் when they come to hospital they go through a screening questionnaire. travel history இருந்தா, fever இருந்தா, symptoms cough, sneezing, cold இந்த மாதிரி இருந்தா we go through a separate hospital protocol here at Kaveri Hospital. அது இல்லாத பட்சத்தில் they get treatment like any other emergency. We wear adequate protection, PPE ன்னு சொல்லுவாங்க, personal protective equipment. இதெல்லாம் masks, gowns இதெல்லாம் போட்டுட்டு தான் we work to try and minimize cross infection to others.